let's talk about some of the things that we're focusing on for 2024. You're listening to the PHEC podcast, episode 333. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. I'd like to share with you what we're focusing on for 2024. This includes the podcast as well as the work that we do through the consulting firm. So let's start with just a few things. It's not like it's dramatically different, but I think it's nice. In the past, if you've been listening for a while, you know I like to kind of give you a little bit of an update of what's going on, what direction we're going in. I'm excited about this. I'm going to share as much as I can, but just to make sure that we're all on the same page, I thought it'd be great to kick off the new year this way. Our focus is about taking action in a variety of ways. Sometimes we as public health, we get caught up in talking about the things that we need to do or that we can do or that we should do, and we don't often just put it to action. Or sometimes we'll put it to action and it doesn't really turn out the way we expect, and we just kind of stop and decide it didn't work and give up. Well, the things that I want to put to action, I want to be dedicated to them and I want to be consistent with them. And I think these are the things that are in our wheelhouse and we're passionate about as an organization, as a company. So I'm sharing them with you. The first area of focus I want to touch on is, for us, it's about continuing to build genuine relationships. We hear that phrase a lot, right? And it's one thing to talk about it. It's something else to actually do it. Through building genuine relationships, that requires a mixture of sharing, of listening as much as or more than you are speaking. It involves engagement and interaction. So if you're a part of the podcast community and you receive emails from us every week, we let you know that the new episode of the podcast has been released. We might start including some questions in there, asking you to respond with a reply or answer a couple of questions for us. We won't overly use this. We do it every once in a blue moon. But if we do send that out, we ask for some participation, because that's one of the ways, now that our community is so large, it's one of the ways that we're able to hear from you, for you to share your feedback in a way that, and we do pay attention to that. We are listening in that sense. So we encourage you to engage, interact when we do share these opportunities. We'll do this online. For example, I've often been on live streams on LinkedIn, and a lot of you have listened to those or watched those. And I ask for engagement, which is a great way to let me know. I can share a question or share my thoughts, and you engage with me and interact with me. Share your thoughts, your feedback, answer the questions, add to what I'm saying. And sometimes people aren't comfortable doing that out in the open, and they prefer to send a direct message, which is okay. I just encourage you to comment with those videos and engage with the live stream, because it's the next best thing to an engaging conversation when you're able to comment back and interact. So there'll be opportunities to do that. And then, of course, on this podcast, we bring some of those back here to the podcast, share these episodes. You're able to interact with us on our show notes page, on social media. These are just some of the ways that we interact, that we plan to do more. In the past, it has been wonderful and very rewarding for us, because it has allowed us to communicate with you in the past, to learn what you want to hear more about on the podcast and what your questions are and how we can help you by being able to provide resources and programs. So we're going to do more of that, because we want to be able to continue to build relationships as our audience and community continues to grow. So in person, we're going to be doing that as well. We have workshops that we will be leading and hosting with community leaders. Here locally, we've got pretty good lineup of some programs that we're going to be doing, some activities we're going to be doing with local leaders within communities. When I say local, I mean around South Carolina and the southeastern region of the U.S., but also across the country, because our clients are across the country. We're looking for opportunities to expand in other communities as well. And we will continue to keep our radar on international opportunities. We really enjoy the opportunity to spread our wings. And we are really proud to have a community that is very much is an international community covering multiple countries and continents. So we're looking for those opportunities to engage with community leaders locally, regionally, across the U.S., and then even internationally. These are action-taking moments for us, or activities. And I hope that you're listening and maybe feeling a little inspired to do that in your local area. Find either some of the ideas that we're sharing about online engagement or in-person engagement. But for us, in building these genuine relationships, it starts from this desire to really share, to engage, to interact, to hear, hold space for our community leaders to speak and really listen to what they have to say. Some organizations do this better than others, but I think it's about consistency. So if you try it and it doesn't work out, try it again, do better, continue, learn from that, apply that so that you do more of what works, and then you revise and you do better. If it didn't work out as well as you thought it would, just don't give up. Our communities are counting on us. Another focus for us, it always has been, but it's really a little more heightened, and we're pursuing this with a little bit more intention. And that is a focus on innovation and disruption. Really doing things differently. We really need to. We've always embraced that. I heard a lot of this conversation last year in certain conferences I attended, in certain rooms where I sat, certain tables I sat at. And well, there's clearly a way to do this really well. But I just want you to know that we are setting an intention to kind of level up our focus on innovation and disruption, because it is just time for things to be done differently. We can't keep doing things the same old way and expecting a different result, right? Another focus for us is clear communication, plain language. And I'm really committing to consistent effort on this, because every time that we think the language is plain and clear, it may not be clear to our community, our intended audience. And we have to be open to that. We have to be committed to consistently putting in the effort to clearly communicate health information in plain language. Very passionate about that. So that is another focus for us. It's a continued focus for us. And all of these are a little heightened for us in 2024 as we move forward. And then finally, I'll mention we're going to be teaching and sharing more about what we do as a public health consulting firm through storytelling. We're going to share examples from our BIPOC community work, our organizations that we're working with, and what we're learning, what we're taking away as a team. We have a lot that we talk about internally, and it's time to bring some of those conversations to you all through the podcast. I think just as you enjoy listening to the journeys of our guests and learning how they got from where they started to where they are now, and learning about what they're interested in and the kind of work that they do, I think that it's important for us to share more about what we learned, some examples of the work, what we're learning through the work that we're doing with our BIPOC community work, our BIPOC organizations, through the consulting work that we do here. So those are some things to look forward to, really starting right now and moving forward into the new year. And we'll see where this leads us. But we certainly have a focus on this for 2024. All right. So once again, it's about action taking. Some of these, like I said, we've done them before, but we're leveling up our focus. So building genuine relationships through engagement and interaction and sharing, both online and in person, through focusing on innovation and disruption at a higher level in a bigger way. really about doing things differently, demonstrating how, being courageous enough to step out there and do something differently and then share it with someone else so that they can feel inspired and encouraged and leveraged to do that. Clearer communication, really continuing to focus on plain language, expressing and explaining, sharing about helping people understand their health information in plain language. This is a consistent and ongoing effort on our behalf. And then also the teaching and sharing what we do more through storytelling and sharing some of these examples with you. That's a bit about our focus for 2024. If you're on social media, on the show notes page, share with us what you're focusing on. If you've got a different focus, if you've got a goal, a plan, laser vision, tunnel vision, if you have some thoughts around this, share that with us. We'd love to hear from you. All right, everyone. Are you ready to move into this new year? I mean, we're here. I guess ready or not, we're here, right? Well, until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.